materials for supervisors. Excuse me. I want to say that we are going to go till 3 o'clock, and then we're going to go into closed session. So we'll be done at 3. Keep me honest there. So we're going to now move to the next part. We've done the laws and regulations and the kind of materials that we want for that. Now we're going to move to the frequently asked questions information. And this is going to be a little bit harder. I think by far the most of the information y'all gave us this morning was stuff that goes on, that we'd want to address on frequently asked questions. I want to call your attention to that particular question that we asked the stakeholders. And I think are the last 2 pages the ones of the materials from, I think it starts on page 29. From the California Psych Association.
It's page 19 of 82 in the complete packet.
Yeah.
And then page 8 of 10 on the 4B packet.
19.
No, so I think, sorry, Dr. Jolinda Crow, there are documents in the back of the room with Ms. Burns that have a copy of.
Yeah, but that's not what, I'm actually talking about.
Oh, you're talking
kinds
about, I
of things we
apologize. I
got
thought we were
here.
talking about the comments.
I
yeah.
am talking about FAQs, but we'll get there.
Got it.
So if y'all take our agenda book, it's under 4B.
Right.
And these are our currently frequently asked questions. And I just want to go to some of the information that was given to us, and I thought, yeah. It starts on page 29, about a third of the way down on this thing that we got, the survey. This thing. The survey.
This document.
And, I'm sorry?
I said this thing, or this document.
This document, thank you. And just want to ask y'all to make sure your microphones are on and turn toward you so that we can, if we have a conversation.
Ours.
Dr. Horn, could I just ask a question before you get started to the staff? I'm not clear. You were asking about the questions that Dr. Winkleman provided. Are those embedded in here somewhere?
I don't know how Solid did that. Are they? Yeah.
Yes, they are in the material, the agenda materials.
In the
So-
green packet?
Yes.
in the green.
It's on page, let me see.
19 of 82.
Yes, so it starts on 19 of 82.
Sorry, I didn't hear.
Page 19 of,
But they don't have that, do they?
They do.
They have it like this? Okay.
well, we have this.
Page 19.
I don't see that the pages are numbered.
So it's item 4. Are you looking for Dr. Winkleman's submission?
Yeah, I was just curious whether they're embedded in here.
So it's in attachment 4B of the agenda packet,
Got it, thank you.
and it's starting on the 8th page of that packet.
I see, so it's attachments, it's the B attachment. Okay, fine,
Okay. CPA suggestions.
thank you.
Okay. So the way this is done here is first we have the FAQs that are on the website. So maybe the first thing we ought to do, and not the answers at this point, but just the questions themselves. Are these still questions that we want to include?
Those are FAQs for psychological assistants.
Oh,
on
psych
the website.
assistant.
Right.
Okay. But not for supervisors?
Correct.
Okay.
So I think that's an important point, that it would be good to have maybe FAQs for each category, or is that too much trouble? I think that's how other boards do it, and I think that would
That's a
be a
good
good
idea. Thank you.
idea.
So we're
Because
right
then
now
it's
we're-
less cumbersome to find.
So right now, we're looking at FAQs for supervisors, but for supervisors, we need to, one of the things we need to do is say, here are the different categories that you can supervise.
Yeah, exactly. That's really
one
important,
of the
because I think that's one of
FAQs.
the big areas of confusion, what the difference is between supervising a psych assistant versus an intern and a registered, yeah, all those things.
Right.
Just to clarify, Dr. Fallender, are you asking if we can do an FAQ that is tailored to supervisors for each particular category, or FAQs for supervisors and delineate in that FAQ
The
different
second.
categories?
The second one,
Just wanted to
I
make
think
sure.
would be better, because it's important to focus on supervisors specifically and then supervisees specifically, and embed all those categories. But I'm
So,
okay with either way, whatever you prefer, it doesn't matter, but I think that's better.
so we were actually talking on the way over, and I'm just seeing this question under the psychological assistants, and I know it's going to go under the supervisor one, but we were talking on the way over about, the question is number 23, can a psychological assistant pay a fee for supervision? And I will tell you that some people who teach ethics to graduate students. Question number 23, under the attachment for 4B, it's page 16. Question number 23, the FAQs for psych assistants.
Dr. Horn, may I interrupt real quickly just to be clear, when you say we, it was not you and me who were talking about the questions.
Oh, right. No, we weren't talking about the questions. We were just talking about, can you charge a fee?
Sure, I just want to clarify, because if the two of us were talking about
That's
it.
a great point. So just to let everybody know, usually when 3 or more board members are together, that qualifies as a board meeting, and that would be in violation of the Open Meetings Act. For a committee that has 3 people, if 2 of us can't be talking about committee business, because that would violate the Open Meetings Act also. So we weren't talking. I was walking to lunch with 2 of the public folks who were here helping us with this, and we were just talking about some common problems in supervision. So that's kind of where we went. So thank you for that, Mr. Excuse me. So what I was saying is that I know a psychologist who teaches this and teaches ethics, and said to me, if psychologists couldn't charge for being supervisors, there would be no supervisors. So that's what I was told. So I'm just saying.
No, everyone teaches, you may not pay for supervision.
I'm not saying that people don't teach the correct thing. I'm just telling you what somebody who teaches ethics told me. So that's all I'm saying. Clearly, this is something that people don't understand. That's all I'm saying. So.
We need to clarify that. Because that's such a huge multiple
All right,
relationship.
that
How
was
can
just
you
a
be
little
objective?
aside. I didn't mean to get us off here.
Okay.
Okay. So, I'm just trying to think about the most helpful way to go through this. And I'm not sure if it would be, unless y'all had an idea about the FAQs for psych assistants, did you have a particular idea that you, about that, or was this just an example or of FAQs, or let me ask what you had in mind.
So the Psych Assistant FAQ, it was mostly provided as an example.
Okay.
So see what like we already have out there that is like one of the resources provided to the public for them
Okay.
to use.
Okay.
And then it could be a blueprint, or if the committee thinks that there are other formats that's appropriate, we can work to develop those too.
Okay. Well, I like the format of bolding a question and then having the answer under it and all like that. So I think that's really good. So it's a good format.
Dr. Horn? Oh,
Yes.
sorry. If it's helpful, I would like to suggest that maybe we take the FAQs that Dr. Winkleman developed as questions that she's compiled and frequently, and perhaps use that as the basis for us to develop the FAQ for supervisors, because as Dr. Joe Linda Crow pointed out, it's very in-depth and thorough and covers, I think, a lot of the issue areas that we've been interested in. And one of the opening questions is this question of what are the different categories of supervisees. And so I wonder if it's helpful to suggest that we take the suggestions from CPA, have staff review this list to see which is in our lane, quote unquote, and go from there. Or I'm curious to know, given that we already have a really great foundation for this FAQ, to use that really as the basis for developing
I think
our
that's
own.
a good organized way to go through it. And if people think of anything else, or if we see anything else from the stakeholders' replies that we might want to add, I think that's a good idea. I think, okay. I think probably it's best for us to determine what is in the board's, is this an appropriate board thing, and we can ask staff, but that's a good way for us to go through it, I think, would be a good thing. Is this something the board can talk about or should talk about? Is it in our purview? But I think that's for us to do, so, okay. Yes, I'm sorry.
I was going to ask procedurally if you would feel comfortable with going through the list of the questions and giving a yes or a no as just a basis. And then if legal counsel or staff has any concerns, we can raise our hands and bring attention any issues we may have.
Great idea. That's what we'll do, yes or no, because we have to think of answers. I mean, and we're not doing that here. We're just like, what needs to be there, so. And these are essentially the frequently asked questions that the California Psychological Association gets, correct?
I think it was combined with the division.
With division,
too.
oh, right.
I'm
The
pretty
division
sure.
on
Is that right?
supervision. Right, well, you're part of CPA, so.
They're part of CPA. Dr. Melody Schaefer, who is here at most board meetings representing Division 2, I think worked with Dr. Winkleman. But let me add that, obviously, this is not meant to be definitive. These are just the things that we
That's what you hear the most.
hear the most, that Dr. Winkleman thought would be important to
Yeah.
include. There may very well be other things that.
I think we have to
would
be
add it.
more thoughtful to be sure that it's comprehensive.
Right,
So I'd
and that's what we're
encourage the
going to
group.
do, and we're not going to
Right,
ignore
right.
anything. We're just trying to go through this. And we also, remember, we have stakeholder
Right.
comments as
Right.
well. So if something is missed here, we've also been asked by stakeholders, so. But it gives us a good structure for going through, so that's good. So let's just start with the overview kinds of stuff. What are the different categories of supervisees? Yes, no.
Yes.
How do the requirements differ between the categories of supervisees? Are there different, requirements depending on where what kind of category there is. Do we want to know that? And the answer is yes. And these kinds of things, I think, I mean, that's a good freak, but these are also the kinds of things that we could do with a nice grid. Here's this
so.
supervisee,
Right.
here are the requirements, you know,
As long as you update the grid as it
and
changes.
update it, yeah.
So again, I'm really not trying to be thick about this. Now you're going through the questions where? In the green book?
ones you just showed me.
In the green
These.
book or,
Right here.
or the ones we submitted?
It's the ones you, CPA
They're-
submitted.
They're in the green book that you
Got it.
submitted.
Got it.
Okay.
Insert.
Okay, so probably what we need to do is say yes or no, and if y'all agree or disagree, we'll just do it that way, because I think that's the way we have to do as a board, or as a committee, we say, yep.
Yep.
Okay. So does that make sense,
Wait, I'm
folks?
sorry, I was talking.
We're going to say yes or no.
Okay.
Y'all change our minds
Or
or,
something, yeah. Okay.
okay. So how many hours of SPE required for licensure? Yes. How do the supervision requirements differ between supervisees who are gaining toward licensure and who have completed the required 3,000 hours but are not yet licensed?
That's not a grid. That is one of the most frequent questions because people feel like once they've gotten the 3,000 hours, people just behave erratically and inappropriately, and supervisors feel like they have no control over it because the
I agree.
supervisee
It's
says,
not
you've
part of the
signed off
grid."
already, off the grid.
Right. It's not part of the grid, and we don't have any good explanation, and this definitely needs to be an FAQ to talk about this. What about that period of time when they've got their hours, but they're not yet licensed? And so then what happens with the work they're doing?
And the
all that
supervisor
stuff?
responsibility.
Supervisor
And the
responsibility.
supervisee responsibility of the supervisor, because the supervisee is still working under the license of the supervisor,
That's right.
even though they don't understand that.
Right.
So that has to be clearly stated.
Here's an important piece. And we've seen this also a number of times just in terms of my time is coming up, I can't be a psych assistant any longer and I'm not yet licensed, and what do I do?
Yeah.
So we've seen this. So I think it's really important to clarify this area and need to put some thought into this. I'm looking at Ms. Chung just shake your head, or
He's nodding nicely. Yeah.
you could shake it this way, I mean, if I'm wrong, but. All right, do supervisees need to register with the Board of Psychology? That needs to be there, and some explanation about registration, right? Are you going to say something else here?
No, I was saying, with the hazard of getting into wordsmithing, do we want to use the word register, or is there another word? What's the word that we're already using for
Registered,
the form? Okay, well, in that case.
isn't that what we use, registered?
For psych assistant, registered psychologist.
Okay, cool.
Is a supervision agreement form required? Yes, we want that information. Is a written,
Especially remember to reference supervisees, interns who are out of state.
I'm sorry?
Reference supervisees, interns who are out of state, NAPA approved.
Correct. We can talk about that. They're not part of this. So we want to definitely add that, just so people who are out of state
For the year.
understand. And in
Or
a
either-
formal internship, that's APIC or APA,
Or postdoc.
or a postdoc, correct. Yes.
But that gets tricky because they're not all APA or, oh well, you can worry about that.
Yeah. We're not going
Yeah.
to get into that.
Could I ask a question about that? So I'm a little confused because whether a person is out of state or not, if they want to count the hours in California, then they have to comply with the California regs, right?
Right, but they don't need to have the same kind of paperwork that we have here. This is for people who are getting their supervision in California.
In California.
Correct.
So if you're outside the
super-
state,
I'm sorry.
don't have to have the supervision agreement signed ahead of time and all that. You just have to accrue your hour. Then there's another way to prove when you
See,
come
what
back.
Even in our in California regs, we have if it's an APA, APIC, or KPIC, formal internship, that's not required either, right? Or is it?
So the supervision agreement is required for all experience accrued in California. So if you're an out-of-state applicant, then you might have some out-of-state experience and California experience. So for your out-of-state experience, you don't need to have the supervision agreement form filled prior because that doesn't apply to them. But if the person also have some experience accrued inside California, then the supervision agreement requirement will apply.
But if they're on a formal internship in another state, then clearly
That is correct.
they're
We
okay.
don't require. This is what we require for people who are getting supervised within this state, not out of the state.
And this is sort of out of my content expertise, then there's another way, if you accrue your hours somewhere else, there's another mechanism for demonstrating those hours when you apply for licensure.
That's right.
Right, okay.
I just want to, I don't want to confuse the matter more. I just want to point out that 1387.4 of the regs talks about out-of-state experience, and it says all out-of-state SPE must be supervised by a primary supervisor who's licensed at doctoral level. They're in compliance with all laws and regulations of their jurisdiction where it was accrued, and they are in substantial compliance with all the supervision requirements of 1387. So I don't know that we can categorically say what is or is not required for out-of-state experience. I think it's a case-by-case basis and looking at what they have to determine whether or not they're in substantial compliance.
So this scares supervisees to death because they're on an APA-approved internship.
They're on an APA-approved internship. They're going to be in substantial.
Well, this also raises,
I don't make those determinations. I just want to point out what the reg says, and I think the staff is probably fairly well-versed in looking at the documentation to determine if there's substantial compliance.
this reminds me that we had a situation this year where someone was being supervised by a VA psychologist in another state, and then learned only later that those hours weren't going to count because the VA psychologists are not required to be licensed in the state where the VA is.
That happens here too. That's happened here
So
recently.
if there's a way to address that, or,
We actually did address it, I
Okay.
believe. I'm sorry? I believe staff addressed that. Yeah, we actually did address that.
so if there's a way to, I know we can't answer every question, but it's not unusual. I mean, the VA is a big system, and so if there's a way to clarify that as you go along with these frequently asked questions, that might be another frequently asked question.
What does it mean staff addressed it?
I believe staff answered the specific questions for that applicant.
Well, right, they answered the question, and I think the answer was your hours don't count, so.
I'm not sure if that was the answer.
I'm not asking about that specific thing. I'm
just
pointing
asking
out that
generally.
that is a situation that occurs, and it might be good in a frequently asked questions to address that question because it's not uncommon for someone to have an internship at a VA.
That's true for military as well. Military can be licensed in one state and not in the one where they're
I'm going
functioning.
to interject here, Madam Chair, and just, can we put that in a parking lot? Because that's in reference to the trainee FAQs. And I think we're trying to go focus right now, just for the purposes of doing this in a organized manner with supervisors. And so I know we have staff who are taking notes on this, so maybe we can put that in our parking lot for FAQs for future. I'm not
No.
done.
I
And
think it
so-
is a supervisor question.
And
They
okay.
need to know that, I mean, the question would be, to serve as a supervisor, do you need to be licensed in the state where you are providing the supervision? The answer is yes,
Phrased in that way, yes.
unless there's an exemption of some kind that would happen maybe later. But I think it is, because it's possible that that someone's working at the VA outside of California might or might not be,
Well,
whose
it's
responsibility
everything.
is it? I know we
It's
can always
everything.
ask that.
You have to be a licensed psychologist if you work for the VA.
Right,
But you can be licensed in any jurisdiction.
yes,
Prisons too, prisons.
Federal prisons.
Federal prisons.
federal prison. So the
And the
question would be
military.
for
Any federal
supervisors.
organization, it has to
Right.
be a licensed psychologist.
But the individual potential supervisor
Might be
needs to know the
supervising
answer to
in
that.
California,
Well, but needs,
but not be licensed in California.
right, so the potential supervisor needs to know so that they can say when someone comes to them, can you be my supervisor? They should be able to say, I'm sorry, I wish I could. However, to me, it's everybody's responsibility to know this information, but it might not be a bad idea to address it in the frequently asked questions.
So we do want to clarify that because now we're talking about the federal system allows, and, that's kind of a mix of things. So we'll address that later. I get that it's an area of confusion, and we need to put it somewhere, and this might be one of those that we pull out to explain differently, like we talked about before. There was something else we did the same thing with this morning about when we did the laws and regs.
Perhaps a section, right now we're under supervision overview, and it seems like that question would be appropriate for a category as supervision out of state, along those lines. I feel like the overview is to capture the broader questions that Dr. Winkleman has put in place for us to have that discussion. But thank you for phrasing the question in a way that makes sense for supervisors. I really appreciate that.
So, where are we? Okay, so let's keep in mind, and maybe this is something we'll want to say in the overview, that these FAQs are about supervision that takes place in California. And let's do that at the top of it, and then we know we're answering about in California. I'm keeping the little caveat.
Yeah, and I
federal
think that's a very
facilities.
good point. And then to Mr. Fu's point, focus on California, and then there are going to be a few of these other things
Right.
that you can cover. I like that idea.
That's right, yeah, okay. So, I think we're on, is a supervision agreement form required? Okay, so yes, we want that there. Is a written supervision log required? And the answer is yes. I mean, we want that information there. Do supervisors need to sign the log, and how frequently? I'm sorry.
Really quick, just for clarification, I think this is the same thing, but if the written supervision log is at the weekly log, I just want to clarify that that's what Dr. Winkleman meant. I'm assuming that's what she meant, but I'm not positive.
I would guess that's correct.
Okay.
She says how frequently.
Weekly log?
Well, it's supposed to be signed weekly. That's what it says. The regulation says weekly. And we tell the supervisees and supervisors to
Right.
do that as a protective factor.
I just think she's trying to say, be
Be specific.
Ask the question.
Answer this question.
It might seem
Answer these
simplistic, but
questions.
ask the question. Yes, they have to sign it, and the regulations say on a weekly basis.
Okay, next question. Do supervisors need to sign the log? We want that there.
Yes.
Is a verification of experience form required? We want that there. I'm looking if y'all disagree. Can a supervisee work in more than one setting during the same time period? So we want that
Yes.
there as well. But this is about supervisees, and we're really focused on the supervisor. So I do know one of the questions was about, or one of the questions I read in the stakeholder feedback was about how many people can one supervise? And I don't know that that would be it might be an overview question. Let's just make sure it's somewhere there. There were also questions about how many people can a psychologist supervise who were like MFT interns, or they're getting hours from the Board of Behavioral Science. We don't have anything to say about that. do we?
No,
Okay.
and they have limits.
I'm sorry?
They have limits, so I don't think we
Right,
should get involved in that.
Right.
So what is our limit, the limit supervisor for psychology supervisors?
Is it 3?
How many?
Well,
Three?
it's, yeah, go ahead.
The explicit limit stated in our laws would be for psych assistant, for supervisors who are psych assistant supervisor, and then the limit would be to 3 psych assistant. However, any other settings, there's no limit.
So it has to be reasonable.
Well, we want it to be reasonable, but, you know.
Wait, could you repeat that? It's a little hard to hear you over here.
Absolutely. So the only limit that's set out in our statute is the number for psych assistants that the supervisor can supervise, and that would be 3. And any other settings, there's no explicit limitation in our laws and regs.
What do you mean, any other
Training
settings?
program.
Like exam settings, like internship.
Just related to psych assistants?
Correct.
That's always been the case, yeah.
Dr. Horn, we had discussed earlier about when we were reviewing the code sections and the regs of the responsibility, and I think this was mentioned by Dr. Jolinda Crow and Fallender about the responsibility to the board.
Right.
And I feel like that's an overview question, and so maybe we can also
Right.
include that in our supervision
Here as well.
Exactly.
Yeah. Great idea, yeah. Okay. Now, questions about primary and delegated supervisors. Who can serve as a primary supervisor? Yes. Who can serve as a delegated supervisor? Yes. And, you know, we're going to want different, whatever differences there are. Must all primary and delegated supervisors complete the course? We want to talk about that. We want to answer that question. Can I have more than one primary supervisor? Okay, so again, now that's for the trainee. It is a question we want to, well, we have answered earlier when we said you can get supervision in more than one setting, and we're not going to, I don't think we should put this here in the, for supervisor FAQs.
I think
Depending
that's
on the setting.
complicated,
Well,
because once you start, yeah, okay, go ahead.
thank you. Okay. We're not going to answer it for supervisors.
Good.
Okay, it's not a supervisor question, okay? Whose responsibility is it to notify patients prior to the rendering? That's good. That's something they need to know. Does the primary supervisor have to be employed in the same setting? And I think we need to explain those differences. We had a lot of questions about that, you know. Does the person need to be employed? You know, what's that relationship and all like that. So we had a number of questions like that, and I think we need to talk about those different kinds of ways that supervisors can. I just keep looking at you, Ms. Chung, because I know you're going to be doing a lot of this, you know, so just want to.
Don't worry.
Have to do
Yeah.
anything except just go, okay, no.
Yes, I will ask question whenever it's necessary.
Okay. But that would be a good place, I think, to explain all those different kinds. So, does a delegated supervisor, so blah, blah, blah. That's a yes. Yes, answer that question. What percentage of time must the supervisor be available? Sometimes it's really hard for me to believe that these are questions that are being asked, like this information isn't getting out, you know? So.
And how long has that been the case, right?
Believe it.
So it's just, I don't know, hard to understand. Maximum number of supervisees, so we just talked about that in one other way, but that's something we definitely want to answer, right? A minimum amount of the kind of supervision, we want to talk about that. Does supervision provided by an audio-visual platform count as face-to-face supervision? We definitely want to address that in our FAQs. And what kind of feedback is a supervisor required to provide and how frequently? And I think that's a good thing for us to talk about as well. Let me think. That's for primary and delegated supervisors. Yeah, okay. And then the law, any additions or corrections to the? Okay, let's move to law and ethics. These were, again, I'm going to say this is hard to read. Can a supervisor be supervised by a family member or business partner? We want to answer that. Can a supervisee be supervised by a current or former therapist? We also want to answer that. Can a supervisee rent office space? So we want to, now that, we can talk about that. That may be, we can maybe roll it into that earlier question about paying for, oh, that wasn't a question yet. That was just something I brought up about
So
conversation.
those three questions for me speak to multiple relationships, and so I wonder if there's a way to encapsulate that under that heading rather than going through all the forms of.
No, that's a good idea. I mean, that's a good idea. We can put them under.
Except those are very specific, unique situations. I mean, I'm on some ethics, the OCPA Ethics Committee, and we get questions about this all the time. So I think specificity is important because people really need to know very specifically that they can't do these things.
Okay. Point well taken. So, can a supervisee be required to supply provisions necessary to practice? All of these are things we need to address, kind of that aspect of the relationship. Can a supervisee advertiser have a website? And that's a good question to answer too. And that's also something that we were in our stakeholders meeting about pathways to licensure. I think this was one of the issues that came up. So it's a good thing to talk about what's required if, if that happens and what needs to be there and like that. So now the supervised experience itself. What's the maximum number of hours per week that can be credited toward SPE? And do those hours include the time spent in supervision? So these are important questions to answer. These are ones we addressed, I guess, when we were doing pathways. Yeah, so hopefully it'll be a lot clearer in pathways, but there's no reason not to put it there, address it in an FAQ as well. So they don't have to read through pathways to necessarily get it. Can all the usual activities of a typical workday for a clinician count toward the SPE required for licensure? That's good because we've talked about that.
Dr. Horn, I'm wondering, okay, so, and this is a stupid question, but usual activities, because I think we've also been asked about some of the, and I think our law refers to administrative.
Yeah.
But that's broad. And so I think one of the challenges that our staff has had is what should we consider administrative and what should we consider as usual? I've heard that a couple times from staff that they look at it and then they're in a situation where they have to determine, well, this sounds administrative, but it's iffy, so I can't really deny it. I don't know if you want to add any to that, Ms. Chung, but it just seems like I've heard this before.
Well, I'm just looking at the very next question, which is what types of activities can and cannot be counted? And that gives a little more clarification, but I do think we need to clarify and work on clarifying that, you know, because that's true.
I think this does come up. Dr. Winkleman has pointed out that this is a kind of broad, general question that comes up quite a lot. What kinds of, I don't know what I can count and what I can't.
Right,
Right.
right.
Since we have some great minds in the room, I'm wondering if we could go through at least the examples and point out whether or not you all feel like those are acceptable or considered administrative in your experience.
Sure.
So, whether these are acceptable, record keeping for clinical work.
Yes.
Yes. These are progress notes. That's part of
Yes,
your
that's
clinical
part of your work. Yeah,
Yes,
it's legal
right.
documentation.
That's right. You have to document what you do, and that's a good one. Other administrative work, like billing for sessions, no. Maintaining supervision log, no. Are you saying yes?
Why not?
That's part of what you have to do. You just are jotting down your number of hours. I mean, we're not going to get that small, right? Or are we? We're not going to get that small. That concerns me somewhat.
Yeah,
I know, it doesn't take any time, so why would we not count it? I
yeah,
mean,
that's what I
you know.
think. I think it's
You
kind
can
of
spend all day
weird not
doing it,
to.
you're going to do several hours doing it.
Well, if you spend 2 hours doing it, you have bigger problems.
It's a different problem, I know, but that's what I mean, so. It's kind of part of what you have to do to manage a case or manage the stuff you're doing. But I mean, I think if we're being asked questions like this concerns me
Okay.
because I wouldn't think to pull that out as part of, it would just be part of what you do as you're managing a case and doing everything you're supposed to do to be responsible for that
Right.
case. It doesn't take long. And, you know, it's like, you know, I've been here 5 hours or, you know, whatever. So that's of some concern. That's what, part of what I'm saying. So how specific can we get? If these kinds of questions are being asked, I'm concerned. And I don't know where the breakdown is partly what I'm saying.
I think I'm asking maybe not so much for the FAQ, but just for clarification for staff, so that we know, because we do get the question asked. I don't know if in the FAQ we could say something about acceptable activities include but are not limited to, and list a few things, but I don't know.
Well, I think it would be more useful not to list these things particularly, but to say that anything that's in support of client work. I mean, like the
But
next
what we
one.
might do is give staff some specifics about this,
Yeah.
so that, because they're reviewing it and they have the questions. So maybe we could take a look at some of the kinds of questions that come up, and this might be in the next licensure committee. What kinds of these kinds of questions come up, so then we have a better idea of where y'all are needing help. Would you do that for the next
Sure.
licensure committee meeting?
Actually, in previous meeting, I think we have also talked about this, that we have plans to address these in Pathways
Pathways,
2,
yeah.
Part 2, because
Right.
I think it would be very helpful for us staff to have some very clean, like, or or more like clearer idea or criteria what the committee is thinking.
Okay, that's great. So we'll do it both places, though, if we can help y'all in the meantime prior to Part 2, Pathways Part 2. So I think it would still be helpful for the licensure committee, if you don't mind.
I think it,
Not this meeting, but,
Right. Yeah, I think that would be helpful because the sooner we know, the better we know what we're looking for within the confine of the regs, how it's written right now.
okay. So if y'all can bring that to the next licensure committee
ask her a
meeting, which I guess is next year, right? It'll be next year. So then we'll take a look at where y'all have, and we'll try to create some kind of guidelines.
so Dr. Horn, I'm going to just go back to a phrase you used, and that is to consider supervision in the broader context. What are you being supervised to do?
Right,
You're being supervised to learn how to be a psychologist.
Right.
And you're termed in support of client service or client work or whatever. So the regulation says no clerical work, for example. So an organization shouldn't use a psych assistant or an intern as an administrative assistant. I mean, that's what they're trying to get at. You don't get so don't send them off to do filing for half a day for the benefit of your organization. That's not learning how to take care of clients. So if there's a way to capture that, that would make it clear both to supervisors, no, you can't just use this person as your admin. That's not what they're here for.
Or pick up your dry
Or
cleaning.
to pick up your, the effective, don't send them out to grab lunch for the staff. So isn't that really what it's getting at, is that you're gaining hours for working in a setting where you're learning how to be a psychologist.
right. I can tell you that some other boards, well, like the Board of Behavioral Sciences, depending on the category, I think, they only are allowed to count supervised hours for how many clinical hours they have. And I think these might be some people, too, who came from that board or that kind of supervision. It might be a different model
Agenda,
than the kind of model that we have. So I think that might be where some of the confusion is, so I'm not sure.
And as far as reading books, part of an assignment, I think, in much supervision is to research the evidence-based practices or see what the best practice is for that diagnosis. So not to count that would be kind of weird.
That's not, I don't think we would consider that administrative work. So I think we're okay. We're going to hear at our next licensure committee meeting, which will be next year. I'm just letting you know. You might put us in your calendar, and I can give you the dates early, when we're going to be taking a look at what staff comes up with.
Okay.
Okay.
Well, let us know
We
in a
will.
timely manner.
In a time. Well, your timely and our timely are two different things, but yeah.
She's either in the country or she's not.
As soon as we know, we'll let you know.
But you know.
All right, can we move on?
Wait,
Well,
she has a
yeah,
comment.
I did.
Oh, I'm sorry, Sandra.
I was thinking in terms of when you're in a formal training setting, all of the things that are here they're part of your hours.
Absolutely part of
40 hours, you're doing a 40-hour a week internship, so it's all included.
Right.
But when you're in a private practice model or a small situation, then these things become more questionable.
Yeah, yeah. You know, that's a great point, because if it's a private practice setting, people are there. It's not the kind of organized training that you might have in a formal internship. So people are there to see their clients.
So the reading is not included, the lectures are not necessarily included, the conversations with they're really focused on clinical hours,
That's
which
true.
then puts those people at a disadvantage in terms of hours.
Dr. Horn, a quick question as a follow-up to that question. And I would defer to you. Would it be helpful to have sort of buckets of formal training programs, exempt governmental institutions, and then private practice as the three broad categories? And that's not exhaustive by any measure, but those are three that have come up in discussion.
It might be. I mean, I think that's a good point. I think we want to kind of look at that. I mean, I don't know of any other jurisdiction, for example, who allows the pre-doc hours to be in a non-structured setting. But we do. We don't require an internship. We don't require, so we allow that. And that puts a different kind of a spin or a different kind of understanding, because those are very different. A private practice, single practitioner supervising a psych assistant, it's very different from that organized and structured program that people would get in an internship, for example. So I think that's a good point, and so let's keep that in mind about
I would be curious since we have our panelists here, are there any other distinct areas that we should be thinking about besides the places that I mentioned, the formal training programs, the exempt institutions, and the private practice? Is there any particular other big bucket categories that perhaps you might want
to think carefully about that before we do that. I'm worried about that a little.
Well, tell us.
Well,
let's just,
think
this is
about
a
that
good
carefully. Let's
idea.
get more input on that because it feels like we're creating classes of training or something. That, the good class is the one that gets all the time to do all these other things, and the private practice class is sort of a slave, seeing clients and not having any time to do anything else. I don't know.
I was just thinking, and I think you had mentioned earlier that a formal training program out of state wouldn't necessarily have to go through the same forms, perhaps. And so I was thinking in that organizational format, since you had raised that issue earlier, but just a suggestion, not tied to it whatsoever.
Yeah. Let's
So
think
I
about
want
it.
to say something about how we work,
Yep.
Dr. Fallender.
Yes, ma'am.
We're going to take our time.
Good.
We're not going to not think about everything. Many times, many months, sometimes many years.
Cool.
I mean,
Lots of opportunity.
we'll have many, many, many opportunities.
Okay, that's good. So I don't have to worry.
You
Stay up all night worrying about it.
You do not have to worry about it.
Thank you.
And I just want to say, I got the percentages from Tricia, so let me just tell you what the percentage was. Here are the supervisors who responded. 6% county with a DMH waiver. 16% exempt setting, this was an academic institution. 14% exempt setting, government agency. 21% formal internship, pre-doctoral internship placement. 31% private practice. 15% formal postdoc training. And 14% other. And let's,
Yeah, that's pretty good.
yeah, so it was a pretty good distribution.
Pretty
They said
good.
the majority in private practice, but that actually mischaracterizes it.
Yeah,
It was
very
the biggest
definitely.
percentage, but it wasn't the majority of
No,
respondents.
not at all.
Yeah.
That's interesting, yeah.
That's exactly right, so that was,
We're happy.
yeah. So that's very helpful. And it's a nice wide, broad range, so lets us know that a lot of people have these questions. And, all right, so let's see where I am now. Put that back down. Are we at miscellaneous? Okay. Miscellaneous. Can a supervisee function under another mental health license while gaining? Well, we need to clarify that because people do have other licenses, but that's not what they can do as supervisors. So we do need to clarify that. That's a,
And the exception was school psychology anyway. That's still the exception.
no,
Well, no.
not in the way you're thinking. If they're working in the school and working as a school psychologist, I mean, that's something else we addressed in.
I think
It used
that
to be in the regs. That was the way it was stated.
Didn't address that.
Dr. Fallender, I think this came up at some point when there was a question about a person who was a licensed MFT.
Right,
Working,
in a school setting.
no, just
No,
working.
Yeah,
And wanting to know if their normal work, if they could count those
and we
hours
said no.
as being supervised hours toward licensure as a psychologist.
Right.
And there was some kind of,
Right, it was something like that.
something like that.
So we do need to clarify it
Yeah.
because, yeah. All right. Can supervisees provide psychological services when their supervisor is unavailable due to vacation and da-da-da-da? So we definitely need to talk to supervisors about what do you do if you want to go on vacation and you've got somebody you're supervising and like that. So that's an important area for us to, or if something happens, you have an emergency situation or like that. What if it happens if a supervisor completes a verification of experience form indicating that the supervisee's performance is below the level of competence expected, and is there a way for any of these hours to count and all like this? So here's the part of the discrepancy issue in question, and you know, what happens if this is, you know, what this means. This is a whole nother. We may want to, this also might be one of those things that we want to talk about. There are a lot of issues connected to this particular question that I think we might want to do a little bit separately, you know.
So not to get in the weeds on this particular issue, but I think this is where, you know, when we talk about incorporating our forms by reference and having the weekly log in our regulation, that this may help with some of this, because our regulation says that a weekly log shall be maintained and that this kind of competence should be assessed on a weekly basis. And the idea is there's no gotcha moments when you get your VOE and all of a sudden you see that you're not up to snuff,
Yeah.
and your supervisor hasn't somehow articulated that, but we don't have a form in our regs. So the requirement's there, it should be done, it's spelled out what should be done, but it doesn't say exactly how it should be done. So like I said, I don't want us to get in the weeds, but I get it, and staff really gets this area, and our hope is that through that Pathways Part 2 that we can solve some of the detailed stuff.
Because other
Something else
boards.
we want to think about what's an appropriate, because of course you give ongoing, a supervisor is going to, we expect that the supervisor is going to give ongoing feedback. And I know in organized kind of like internships and stuff like that, they have periods of time where they actually are going to give them feedback for where are you at this point and what you're competent, you know, and blah, blah, blah. And we haven't done anything like that. We're just saying it should be ongoing. Yeah, so the point is not to have these gotcha moments. Right.
Right. Unfortunately, the research, even current research, is showing that there's not much feedback going on.
Yeah,
and that the law of no surprises isn't exactly succeeding.
And there are a lot of reasons for those gotcha moments other than the person didn't perform up to par, which we've been learning. So, you know, that may, you know, so anyway, this is another issue, but we're looking at this too in terms of a process for things like this. Yeah. And what if a supervisee has a complaint about a supervisor? And that, I mean, that's a good question. That won't be for supervisors, but we definitely want to talk about a process and make a process okay. And that the supervisee or trainee doesn't get hurt because of a complaint the supervisee's made. But that's another thing. All right, so that's our FAQs. Anything else jump out at y'all at this point in time? We are going to look at the, not right now, I'm sorry.
Last question.
The very last question?
The complaints question?
Yeah, we just-
Dr. Horn just addressed.
Yeah, she just,
What if a supervisee has a complaint?
yeah.
Okay.
Dr. Horn, one question I would add, not necessarily for the miscellaneous, but just in general for the FAQs.
Yeah.
Would be what forms do I need to complete as a supervisor? It seemed to be a frequent question for folks is what's the documents I need to keep myself and
Yeah.
submit to the board. So
Okay.
I would recommend adding that.
That's a,
Another question that does come up is whether there's a legal requirement for supervision notes. That's a
Okay.
common question.
okay. All right. So do supervisors need to keep notes?
Well, you know, in British Columbia, the regulatory board requires supervision
Yes,
notes, for example, and there's some other jurisdictions that are either thinking about or are going to in the US, so.
I'm wondering, to piggyback on your question, Ms. Chung, have we asked if they don't have a weekly log for the supervision notes as another supplement to?
So the weekly log is required per regs. It's just the format that is not specified. So whatever they can give us that consider as a weekly log with all the information contained within the regulation section, we will review it.
So that's kind of interesting, actually. Might want to say that. Might want, not want to, but just think about it.
What, about what?
What are you saying?
Well, that doesn't just have to be a grid piece of paper. It could be, I mean, I don't know how you'd say that, but whatever, that it could be more expansive, the weekly log.
It could be. We've just specified what needs to be in there, but not, it's not a check. We haven't,
I know you have no form.
Not the format.
yeah.
But you know, some of the schools have a form that they disseminate, like Alliant disseminates it to everyone. Most schools use Alliant's form, or many schools do.
This is a question to either Ms. Chung or Ms. Orick. Do we know from our colleagues in other jurisdictions if they have a weekly log format that is similar to what we would require? And if the answer is we need to look into it, that's great. Understood, thanks.
All right? Okay, that's FAQs. We have half an hour to go to 4C, which is best practices. And what we have in terms of attachments to 4C are Bucky et al. Talking about what are good characteristics, basically, that doctoral students have talked about. I think our best practices need to be, we need to update them. We've certainly heard that. So let's think about what we need to have there. Do we have our best practices in this part? In our materials?
It's on a website.
Yeah, I know it's on our website, but, okay. Yeah,
Not to be mean, but I would encourage you not to use that article as the basis for best practices.
I'm not using the article as I'm just saying this is what we have in there. And it does give some good ideas, though, about what people who are being supervised, the kinds of things that they find helpful or not, so.
Would you like Division 2 to send you materials on best practices?
Yeah, that'd be great.
Okay.
So, but you can also you can tell us in this next half hour what, some ideas that you have. And I think this morning you did talk about some of the best
did.
practices. So
I did.
we have that information. And Solid's going to compile all the information that y'all gave us this morning.
So I have a question related to this, what we would provide to supervisors, because what I heard this morning from Dr. Fallender is that there are two really great resources out there from the APA and ASPPB related to these items, and I wonder if it, just at a 35,000-foot question level, if it makes sense for us to, on our page for supervision best practices, to just link out to those documents and leave it as that, or what's the level of detail which we want to engage in developing a set of best practices, whether some of it, I think we heard comments earlier today about having a high-level summary of those two documents, but I would be curious just from a structural perspective, if it makes sense for us to link out to those documents or have the resources that Dr. Fallender mentioned that Division 2 uses posted on the website and leave it at that, or how much further we want to go into.
So where is our supervision best practices on our website?
Psychology.ca.gov/applicants
I'm at our website, so tell me where I go. Applicants?
to supervision_best.
Supervision and training. Okay, supervision best practices.
Yeah.
Thank you.
That's the page, I think, from Rod.
Yeah,
Yeah. Honestly, I reviewed it last night, and it's archaic.
And we really appreciate that review, and think that's the discussion we had this morning about taking that out and updating it with the information you shared with us.
And we could consult, I don't think Mary Lee Nelson's still involved, but I mean, Rod would be happy to contribute. I talk to him every day. Ed would be happy to contribute.
that'd be wonderful.
Various leaders in the field would be happy to
I
contribute.
think that would be great.
Can I follow up? When we say contribute, again, going back to the structural question, are we providing here's a library of resources, or is the contribution a updated summary or whatever word that you're actively writing and submitting to go on the board? I think that's
So if we look at this one, if you just read right at the top, this is provided for informational purposes by experts within the field. So I think we might want to do exactly the same thing. What Dr. Fallender is telling us is she can actually get the same people who are still experts in the field on supervision.
Not all three. Two of the three, and then some others. Two of the three and a few
Okay.
others.
And to avoid a situation where we're using outdated information, what's the frequency cycle you would suggest that we relook into this? Is it annual, every 5 years?
A decade, once a decade would be fine. But once new guidelines come out, if ASPPB has a new task force on supervision, that would be the time. If APA has another set of guidelines or revision. So someone just needs to be on top of where the field is going.
So what I'm hearing then, it's helpful to have this, as you just mentioned, Dr. Horn, provided informational purposes by experts from the field with contributions from Dr. Fallender, and then link out to the two pieces that we discussed earlier, and then have staff just be on the lookout once a decade, or ask once a decade what this information needs to update it, in addition to any additional resources from ASPPB or APA.
the big organizations that are
Yeah.
taking a look at this issue.
I think we've just
Yeah. So something like that, that a best practices we can provide on the website, we can say we got this. We might still, as a board, do a little summary and all like that, because we put it together, I think it was put together with specific questions we wanted addressed or something like that.
That was so long
It
ago.
was a long time ago, but where we thought people were getting confused and.
I think Emil organized it. I'm pretty sure Emil organized it and we all contributed and he put it together, but I don't know why he didn't put his name on it.
Because we didn't add anything new.
Oh,
We just took what y'all put, organized it, and,
yeah, whatever.
wanted you to address certain things that we were seeing as problematic at the time, so I think that's what happened.
What's the timeline for this?
I can't speak to the timeline. I can't speak to a timeline. I just want to speak to the caution that the board should exercise when posting something called best practices to make sure you're not getting into underground regulation areas where you're saying if you don't do this, then it's a violation of the Practice Act or something along those lines. It's
So how would
something
this-
that's not.
If we did something like said, we asked, or we sent out this and asked some experts in supervision what they thought, or what do we do? I mean, how do we say best practices?
It's long.
What?
reflections on supervision as the title instead.
What would be the appropriate way, so that we don't want to overstep. I mean, we're not going to talk about conflict management or things like that.
It would be a list like establishing a supervisory relationship, being vigilant for strains and ruptures in the relationship, being multiculturally competent and thinking about the multiple identities of the clients and the supervisees and supervisors, a list like that. That
Yeah,
would be pretty consensually. I mean, I don't think there's any supervisor that I know of who wouldn't agree. So I don't know. I mean, I don't certainly need more work. So if you'd rather I not, you can just give the references
That's
to
what
the
I'm trying
two.
That's what we're
Yeah.
trying to figure out. I
Yeah.
don't say that's what we're trying to figure out. We don't want to do something that's not appropriate
Right.
us
You
to
all
do,
work it
or
out.
we don't
Let
want to
me
say
know. It's
that because
fine.
it's written down here, this
That's
means,
minimum
we've
standard.
created a regulation, and with,
Right.
and it's not, it's really just
Yeah.
guidelines.
So I think there
It's
are
kind of
sort of
guidelines.
helpful hints in how to move forward in the relationship versus if you don't do this, you're at risk of violating
Nobody
the
would,
Practice Act. And I think you
I'm
just don't
certainly
do it.
not going to say that. I mean, I don't think any of us would say
I
that.
know you wouldn't say it.
Right.
That's.
But it's the implication that the board would take
Yeah,
action
this isn't
based
about
on
what you would
doing it
say. It's
differently.
about how do we
Right.
present it and and how it might be read. Sorry, yeah.
Mr. Thomas, I'm looking at you because I think we might have, I don't remember where we put this on our website. I can't find it at the moment, but there was a way that we introduced the document that APA and ASPBB put out on telepsychology guidelines. And I want to say that we kind of did a disclaimer where it was that we were not necessarily endorsing this as policy, but, and I don't remember how we worded it, but somehow we put a disclaimer on the document that this was to provide information that might be useful, without saying, like, if you don't follow everything on this document, then you're going to be in trouble with the Board of Psychology, in other words.
That's what we don't want to do.
I think that's what you put on the one you've got now. Somehow that's the wording. I can't pull it up because I'm not on the internet, but I looked at it earlier. It had some kind of disclaimer on it.
No, we
that it
don't.
was- No? Yeah.
Yeah, I think with the telepsychology documents. Hello? So with the telepsych documents, I think we just had like some type of a preface that said that this was a document that was created by the Joint Task Force. So we didn't really, I don't recall it being a disclaimer, but it was clearly not ours, and that we were kind of using, our telepsych committee was using those documents to kind of get ideas and suggestions, but not as I don't think it was a formal disclaimer, but
Was this the notice to California consumers regarding the electronic delivery of psychological services? Is that what you're referencing, Ms. Sorek?
no, that's something that has kind of been on there for quite a while. This was when we were kind of developing our regulations. And you said you can't find it on there now. So we might have taken it down just because we're kind of beyond that point. But it should be referenced there somewhere. Oh, it would be part of the underlying data.
You know what? It is on the licensees page under practice guidelines, articles, notices, and other useful information. So on that page, if you click on APA guidelines for the practice of psychology, is what the link says. And then, and that just leads to that document. And that was the Joint Task Force
Task Force.
guidelines.
And it's not just APA's guidelines, I want to say, even though they put it on their website in that way. But there were 3 organizations that contributed to that, those guidelines. So what do we say there? We just put a link there. We didn't say anything about it except just put the link.
But it sounds like there's a way to address Ms. Mark's concern, and maybe best practices isn't the right term. Maybe it's something else, but I think there's a way for us to do it, to include some thoughts from field leaders and to include those resources. I think that's what I'm hearing. Is that correct, Ms. Marks?
I think there are ways to do it. I think that what you're going to have to look at in each of these practices that you discuss, whether or not, if it's not done that way, whether it would be considered a violation. And if you're looking at it from those terms, then you're going to have a problem with it being an underground regulation. But if it's, when I look at some of these, items, something like how client assignments are to be made, I'm guessing that that's a good discussion between the supervisor and the trainee about, well, we're going to talk about what issues may come up with this particular client, et cetera. That sounds like a fairly helpful hint and nothing that the board would take action on if you don't do it that way.
Right.
And I think that's what we'd have to look at with each of these suggestions.
Sure.
So I do think there's a way to do it. I think you just have to proceed with caution
Cautiously.
when you're talking about these are the best practices.
Yeah.
So we may not call it best practice, but, good supervision, guidelines to assist with
Right.
supervision or something like that. I don't know.
Considerations in the supervision
Those-
relationship, something along those lines.
Thanks for bringing that up.
Good.
And, because we do want to be careful, and that's for us. It's not for you. It's
No, I
for
get
us
it.
to be,
So you'll let me know how soon you need it and if you need it. But
we would
no,
like it. We're telling you now.
you would
We
like
would
it.
like it.
And how soon?
Well, let's see, our next licensure committee meeting is in January, so,
Okay.
okay. Okay? Would that be possible?
I think so.
Okay, thank you.
When, in early January or late January? Just checking. What?
To be determined.
Oh, okay. Well, when you find out, let me know. But I think that's possible.
Thank you. All right, so I think we're done with the supervision videos.
So we're off duty?
I said that on purpose.
So it's an 8-hour video, is that,
I'm sorry?
it's an 8-hour video?
We're going to answer everything, and
Sorry.
we will have a table of contents, but
And I know you mentioned that we'll go through the survey result report at another time. Is that correct? Or
well, as we're putting together things,
Oh, right.
we'll incorporate this as well.
oh, that's right.
Yeah.
Okay. And I should mention that my question about forms came actually from the review of this document. So it was
So-
inspired by myself.
Okay, good. That Pathways to Licensure Part 2 is getting pretty hefty. So we're going to adjourn into closed session now. So I would really like to thank the people from the public who came and really helped us think about how we can be most helpful to supervisors in the state and what they're doing. Really appreciate your taking your time, coming all this way to help us do this today. I want to ask, do y'all have any last things anybody wants to say? We'll let you know when we're having our next supervision discussion.
That would be great. I just want to say on behalf of Division 2 of CPA and me and all of us who work so hard in supervision, we're very appreciative of your work and very excited about this because it's such a critical component of training.
Yeah, it is. So thank you very much. Thanks. Yeah.
It's been sort of a great introduction for me in terms of supervision. I've taken the classes, and it's like, so this has been very, very interesting.
Great, great.
And aside, this is not about supervision, but I'm wondering why a requirement for inpatient inpatient experience is not a part of psychology training.
Required training?
Required, yeah, because you know, I've run across people who really haven't seen the spectrum of, and I know it's been discussed, but I just
No,
wondered
actually,
about that.
and we can't discuss it now either.
Sure.
So, just to let you know, I mean, you've brought it up. We can't discuss anything that's not on the agenda.
Oh, I
That's
see.
That's
Okay.
just the way. So if you are interested in kind of bringing this up at a future board meeting, then you can say, yeah, I would like to see this, and then we can put it on a later agenda. But
Okay, well, I feel like it's something that, and I'm sure it has been discussed, but it's just something that's important. That's what I would think.
okay, are you
Okay.
asking us to put it on a future agenda?
My feeling about it is, I think you've probably really discussed it and decided against it. That's my thought.
Okay.
And so if that's already been done, I wouldn't want to ask you to do something that would be redundant. But
Okay. Well, thank you very much for your feedback.
And we hope to see you at a future.
Yes.
Thank you all so
Yeah.
much.
Thank y'all so much.
Here's
Yeah.
this form, I'll just leave here. and this-
Okay, yeah, just to say that we are closing the open session of the licensure committee. We're going into closed session. We'll only come back to adjourn we'll come back into open session to adjourn, so this won't be webcast anymore. This is the end of the webcast. Oh, and we will reconvene at 10 a.m. tomorrow, the licensure committee, 10 a.m. tomorrow. Thank you.